I can't remember asking a children's hospital about this, but what kind of regulatory things are you looking at? Are you looking at 21st century cures? Are you looking at price transparency? What regulatory things are on your
We
plate?
are. It's interesting. We went live with our shoppable services on January 1st. And so we actually, if you went to cookchildrens.org, you could get estimates on the 400 procedures that we're required to do. Also in our patient portal, My Cook Children's is what we call it, My Chart. You can actually do pricing estimates in My Chart today, where you actually can put in, I'm having this procedure, and we'll provide the pricing estimate. And we also have the machine readable files that we've produced. We felt that it was important that we start providing that information to our patients. Other facilities have decided that they'll just wait it out and see if they get fined and those types of things. But we decided we would go the more conservative route and just go ahead and bite the bullet there and start providing that information to patients, which I think it's the right thing to do. So we've been doing that since the 1st of January, which, I wish I don't have really a lot of data about how many people have used it, but we'll be looking at that to see how that's going. And the 21st Century Cures Act absolutely applies to us. So we were thankful for the little delay from November to April as far as providing, real-time access to your medical record and being very transparent with your data. Because in PEDS, there's a lot of sensitive data that we wanted to be able to go through more thoroughly and not just have to release everything automatically to families and patients, because some of that requires, education and discussion to those particular patients. And there's some unique issues there because each state, depending on their laws, some kids own their patient record at age 12 and 13.
Yeah.
And so what's the risk of sending a negative result or something could change the life of a kid to a 13-year-old just automatically. So we're actively working through the information blocking provisions and the API provisions to be able to provide data to other applications if asked. Pretty much most of the things apply to us. If you looked back to meaningful use, that was a little bit different because of Medicaid, and that was really state dependent. So like in our state, we just had to say we implemented something and we received meaningful use dollars. It wasn't we weren't judged, we weren't reviewed on metrics, but that's going to change over time, I think, for PEDS.